Welcome to our Health Equity Chat podcast. My name is Cynthia and I'm a health educator from our Health Equity program here at Southern Nevada Health District. Today we are highlighting the minority mental health to raise awareness on the challenges that affect mental health on racial and ethnic minority groups. We feel it's important to create awareness and learn more about mental health and find ways to help support with this topic. Just to give you a little bit of background, I know this was formally recognized back in 2008, the month of July, as being Minority Mental Health. And it was thanks to Bibi Moore Campbell, who she advocated for this to be a month for awareness, which is amazing. I think it needs to be, we need to shed the light on this topic. Before we start, I want to introduce our guest. So we'll start.
Thank you. I'm Rebecca Cruz-Narias. I'm a senior health educator here at Southern Nevada Health District.
Thank you. I'm Tabitha Johnson, Behavioral Health Manager from Southern Nevada Community Health Center.
And I'm Dayanara Goss. I'm a community health nurse case manager with the Nurse Valley Partnership Program.
Thank you, and welcome. Thank you for being here. I want the community to know about our amazing staff that do amazing things every day. And we're going to start with some questions. This is something that I wanted to bring to the community because there's such a stigma. People don't like to talk about it, and there's such a need for this type of services and topics. What are some common mental health conditions that you see in your line of work? And anybody can respond.
I'm guessing the licensed therapist here. A lot of anxiety and depression these days. Historically, previous to the pandemic, a lot of PTSD, but now even more so, we're getting to see folks, especially from minority communities, coming to therapy for the first time. So that's exciting for me because it tells us that we're getting the word out. People are finally saying, okay, I need some help. So we're recognizing that there is a need.
Yes, I agree that there is a need, and I'm glad that people are coming out and saying I need help with this because it's again, there's such a stigma with this topic, and we do need to recognize that there's, a need for this, and we need help. And that's the first step, but recognizing that I need help with mental health. What do you think are common contributors of risk factors for mental health? What do you think?
Socioeconomic status sometimes can bring additional stressors. A lot of the folks that we work with are low income, some of them experiencing homelessness, food insecurity, just a lot of the challenges that our communities are facing, especially with the rising prices of housing, gas. People are struggling.
And common research shows that specific groups experience higher rates of mental health. I know you mentioned some of the stuff, the contributors. Anything else that you think that?
Even family history. We always want to look to, previous diagnoses, anyone in your family been treated for mental health concerns, any medications that were prescribed. We try to do a really thorough history so that we can best understand how to treat.
That's great, thank you. We'll continue. One of the topics that I would like to bring to light is suicide prevention, because suicide prevention is so big, and a lot of people don't want to talk about this. It's just they hear it and they don't want to know anything about it, and they don't want to talk to even family and friends. I know there's some alarming statistics about it, and Rebecca, can you tell us a little more about that?
Absolutely. So just talking about the stigma surrounding suicide and mental health in Latino communities in particular, there's just some misconceptions that if I could share. Talking about how a person is feeling emotionally and or asking about suicide will put negative thoughts in their head, and this cannot be further from the truth because those thoughts are there. We're just going to bring them to light. So discussing suicide openly and honestly in a safe space is an approach to address this stigma. So talking about it provides an opportunity to address those thoughts and discuss how one can keep safe. It does not give them the idea, as some people think, and like I said, focusing on that stigma, but instead it provides that person the opportunity to have that support that they've been looking for. And then there's also shame and guilt. So often in Latino communities, there's a shame in talking about it. So the word suicide can be taboo in the Latino culture. So historically, we have not fostered a culture of talking about our feelings. We hide family problems. We're told that what happens inside our home, we're not supposed to share with the community. That's private things that are happening. And then we have that expectation that people should just get over it because we're brought up to just say, you be tough going, you just gotta pull up your pants and keep going, right? And that's not how we really wanna look at mental health, but that has been culturally how we have accepted dealing with hard times and hard situations and mental challenges. So we don't want people to think that bad things about us. We don't want to be labeled. So that continues generation after generation. And a lot of times they're given those words that aren't proper to use when we're talking about mental health. So talking about being crazy, or in Spanish, being loca. You don't want to be called that. So if you express that you're having anxiety or depression, you're stigmatized. So you don't want to discuss those kind of things and talk about your suicidal thoughts. So we want to just kind of open that.
Yeah, I agree. A lot of times we're afraid of because of our families and, we don't want people to think different of us, right? And even though we're going through a lot, we just don't want to put anything out there. And it's important to bring it out and stop talking about it. And also, as listeners, when you see somebody acting different, kind of ask around, try to find out if they're okay. I always try to do that with people that are, around me. If I see something, I say, start the conversation at least, right?
Right.
Because sometimes people feel lonely or they don't have anybody to talk about this type of, situation. So thank you for that, Rebecca. And then I was going to ask if what is the stigma surrounding suicide and mental health in Latino communities? I know you mentioned some of that stuff.
Yeah, so those two things, I apologize. I kind of wanted to just touch base on the stigma since you brought it up. But you did ask about our community being at risk, and we are absolutely at risk. And some of it is because of those stigma, so the misconceptions and that shame and the guilt. In short, yes. So suicide does not discriminate. There's everybody in the community is at risk. That doesn't mean everybody has suicidal thoughts, but that does mean that we should be aware and be looking for signs and symptoms in everyone that we work with, that are our family members, the people that we come in association with, because everybody's at risk. So according to a survey conducted by the U.S. Centers for Disease Control and Prevention, 1 out of every 4 teenage girls and 1 out of every 10 teenage boys in the Latino community has considered suicide in this last year, 2023. And according to the Office of Minority Health and the U.S. Department of Health and Human Services, 50% of Latinos are less likely to receive mental health treatment as compared to non-Latinos. So there's many factors that can contribute to this. This includes access to care, traditions, cultural factors, misconceptions that mental health is not as important as physical health, and as we discussed, the stigma and the misconceptions that surround us and how we have grown up and think about mental health in general. Problems that existed before COVID-19 got even worse during the pandemic, so in the Latino communities and all communities. So I want to emphasize, I am giving some information about Latino communities, but all communities are affected by this. The increase of substance use, job loss, poor access to care, and the stigma of mental illness increased. So as I mentioned, many different communities are impacted, especially post-COVID.
Thank you, Rebecca, for those statistics. One of the things that we often see in our family sessions or rather individual sessions is a person from, say, the Black community might come in and they're receiving kind of a lot of frustration or why are you in therapy from the rest of the family? And, that stigma exists and people are just, why do you need to go to somebody you don't know to talk about your problems? And what's interesting is 3-6 months down the road in treatment, those same family members are now asking to be referred to therapy. So it's helping break down that stigma.
Absolutely.
So thank you for sharing that.
Yes, thank you. It's so important to have the support from your loved ones to, be able to make a decision that, so now let's talk about some of the programs that we offer here at Southern Nevada Health District for somebody who's seeking services and resources. We'll start with the behavioral health program that offers multiple services to the community.
Thank you so much. So we have a federally qualified health center called Southern Nevada Community Health Center. And within that, we have a behavioral health program that offers individual, family, and couples counseling, in addition to psychiatric care with 2 nurse practitioners. So folks who are needing medication, in addition to therapy, can receive both of those services on site. We do have 2 locations, Decatur and Fremont, as well as telehealth is available, and in Spanish.
Yes. That's great. And then we'll talk about another program that we have, an amazing program. Dana, do you want to talk about your program?
Sure. It's the Nurse Family Partnership Program. We're a community health program that is provided for first-time moms. And so we are all nurses. We go to the home and we provide resources to them. We do assessments, a lot of education. We want them to be good moms. So, we're there to support them in that way. So,
What are some of the mental health conditions that you've seen that women face during pregnancy? And anybody can.
yeah, there's a lot of anxiety, especially if it's an unplanned pregnancy. If there's a history of depression, then that comes into play, and then also postpartum depression is what we see.
And Tabitha, I'm sure you can talk a little bit about the symptoms of postpartum depression for women that are pregnant.
Right, so sometimes the preoccupation with, am I doing this right? Waking up in the middle of the night frequently, checking on baby. Sometimes women will talk about just kind of having dark thoughts or thoughts of even harming the child. That doesn't always happen. These symptoms are very individualized per person. But if we previously had depression before pregnancy, definitely a little bit of a higher risk there, and just wanting to work together with your primary care physician, your OB, and your mental health team, just so everybody's on the same page. We've got all those changes with hormones, lack of sleep, those types of things. But yes, I would agree, a lot of anxiety as well.
And when somebody comes to your program, Leonetta, with these type of issues, how do you help them, or how do you guide them?
Well, initially when we first enroll a client, we do an assessment and then we do a screening. If they're high on the screenings, we do the GAT7 and PHQ-9. If they're high, then we obviously refer them and then offer support in any way we can, so that they can go ahead and get treatment.
I think this is one of a great program that can offer support to women and that are pregnant. For sure, thank you for sharing that. And do you care to share about a success story that came from your program?
Sure. I did have a client recently. She had a history of substance abuse, mental health, some depression, and so that just was exacerbated when she became pregnant. So, in the initial screening, in the initial visit, then I did an assessment and screened her. She was high, so then I gave her the referral, the resources, so that she could get treatment. And with my support, she was able to get treatment because she had stopped all her, treatment prior, and she's doing great.
That's a great
Yeah.
story. That's a great story. Sometimes that's all we need, a little bit of support, right? Just a little bit of
And
support,
guidance.
guidance. Yeah, that's a great success story. What are the eligibility requirements for the Family Partnership Program?
They have to be a first-time mom, be less than 29 weeks pregnant, and then live in a certain zip code. We cover a lot of the city. So if they live in those zip codes, and they have to be of low economic, financial, how do you say it? Anyways, they have to be, under a certain threshold,
Okay.
depending on the finances. And if it's really easy. You can just call in yourself to a self-refer, or you can do it through the Nurse Family Partnership Program.org. You can refer that way as well. The WIC offices give us a lot of referrals as well,
That's good.
and other community resources as well. And it's easy. They just call 702-759-0779 to self-refer.
Thank you. Thank you for that.
And if they don't qualify for our program, we do have another sister program that we can refer them to.
Awesome.
Yeah.
Always great to have other choices. So we're coming to the end of the podcast, and I just want to ask, what can the community do to help with mental health? Can you offer some tips?
Sure. I think a really important part is to empower individuals with lived experience in our communities to share their stories. When it's appropriate, of course, when they're comfortable sharing these stories, but it makes people know that they're not alone in this, that it's not only happening to them, that it happens to other people so they can feel supported. Sharing those experiences really normalizes having those challenges that we face in everyday life. And so we just know that it's not something that's we can't handle or we're not strong enough. It's something that's just happening, and it's okay, and there's a way to get through it. So when a person opens up to you, if they do, if anybody's watching and have somebody who's challenged with this and they finally do open up to you, We just ask that you listen, you're patient, and you're empathetic. You don't want to pass judgment on them because it takes a lot to have a person disclose things to you. And obviously, if they feel comfortable and they trust you enough to start that conversation. So I think empowering that, and then also providing opportunities for people to stay connected. So how can you do that? So sharing strategies that work for you, or provide parents ways to connect with youth. We know that youth is an area of concern, especially in our community, when they're having thoughts of suicide. So how can you have that connection? And then staying aware with what's happening with loved ones, whether it's your own children or if it's family and friends or people you work with. Staying connected, asking questions. You mentioned that earlier. If you see somebody and they have an expression and their signs and symptoms, just asking how somebody is, opening up that conversation. So I think those are very, very powerful ways that you can have somebody know that you're there for them.
Thank you, Rebecca.
So this might be a little controversial, but if you're noticing some changes in your mood, potentially look at how much social media am I consuming. Noticing a lot of impact with social media that can be, it's a great tool when it's used in the right way, but potentially a social media fast could be 5 days. How do I do without social media for 5 days? Sleep, hugely important. Sometimes we think a mood disorder is happening, it might just be lack of sleep. So some basic things, and then along, talking about it, just normalizing. We've got the, oh my goodness, the movie that just came out.
Inside Out.
Inside Out. Sorry, I was having a moment, guys.
Watch that tonight.
Inside Out too. I just love that we're starting to really normalize and talk about feelings, and I think we even bring in the character anxiety. So just having those dinner conversations with our friends, our family, talk about it. So that would be my 2 cents.
Anything you want to share, Hannah?
No, I agree with what they both said, and, just being aware and then seeking help, I think is so important.
And being a good listener, right? Being a good listener. If you see something different, talk to the person. And if they're willing to open up, just listen. If you can help them, somebody can. You can always help somebody else.
Absolutely. I would just want to mention too that if you don't feel prepared to be that good listener or that support, there's trainings in the community that are available to you to help you recognize signs and symptoms of mental health disorders or suicide ideation. So there's youth mental health first aid, there's adult mental health first aid, there's a Safe Talk that helps you with those kind of things. So, reach out to snhd.org. There's things listed for resources so that you can get connected with community partners. Often those trainings are completely free. We offer that here. We try to work with community, but we definitely work with partners who are offering that out in the community. So if you don't feel like you're quite there, like I don't want somebody to disclose something to me because I don't know how I would handle it, there's ways to be prepared for that. So that's what you can do as well.
Thank you. And tell them if somebody wants to reach out for behavioral health department, do you have, what's the contact information?
I wrote that down because I did not have it memorized. 702-759-1700.
Thank you. And this concludes our Health Equity Chat podcast, and I hope this was helpful for the community. Thank you for participating, and thank you for the amazing work that you do.
Thank you. Thanks so much for bringing us to life.
Thank you.